Good afternoon, everyone. Thank you for joining me for another RVH Virtual Town Hall. I'm Janice Scott, always proud to be your president and CEO. This has been a punishing third wave of the pandemic that has pushed many hospitals close to the breaking point. The crisis is real. The crisis is here in Simcoe, Muskoka. In this wave, patients are younger and they're getting sicker faster. 10 days ago, we were caring for more than 60 COVID positive patients. In mid-March, we had only 3 COVID positive patients. That's how quickly the situation escalated. Our numbers are down a bit since then, 22 COVID patients at RVH today. Although ICU admissions across the province have declined slightly for 5 straight days, the number of patients in ICUs across the province continues to be alarmingly high, 877 patients today in the province of Ontario. RVH's 16-bed intensive care unit is full most days, and we have enacted our critical care surge plan, enabling us to create 19 additional critical care beds throughout the health center for a total of 35 critical care beds. We're now caring for critically ill patients in our cardiac care unit, and we've just completed renovations in our endoscopy unit to use it as a critical care surge space. We have 3 COVID units, as well as the ability to operate 45 of the 70-bed regional community care workers from across the province who have volunteered to work at RVH. We're also hiring up to 60 part-time externs. Those are healthcare students, including nurses, physicians, paramedics, and respiratory therapists, all in their final year of training. They're going to provide additional support under close supervision. The situation remains dire, yet there are still people who don't believe in the severity of the situation or the importance of vaccines. They see quiet hospital hallways and empty beds and think the crisis has been exaggerated. They ignore public health guidelines and gather with friends. They attend rallies. So we're here today to bust some myths, to give you evidence-based facts. Joining me today is Dr. Chris Tebbett, Vice President, Academic and Medical Affairs, Dr. Amir Korsavani, RVH's Medical Director of Infection Prevention and Control, Dr. Adarsh Taylor, an ICU physician and respirologist, and Kathy Clark, Director, Safety, Security, and Occupational Health. Thanks for joining me, panel. Let's begin with Dr. Tebbett. 41% of adult Ontarians have now received at least 1 dose of the vaccine, with more than 200,000 doses administered in Simcoe, Muskoka. Yet there is still a lot of misinformation out there that may be dissuading some people from getting immunized. So Chris, the first myth should come as no surprise. We hear the vaccines aren't safe. They were approved too quickly. The side effects can be dangerous, and we just don't know enough about their long-term effects. So Chris, what are the facts?
Thanks, Janice. So the first comment I'll make, and I'll elaborate on this, is that the vaccines are indeed safe. The second comment up front is that the danger out there is not COVID-19 vaccine. The danger out there is COVID-19 infection. And what I'm about to say, we'll keep those points in mind as I proceed. The approvals, have they been quick? I've said this before. It was a very quick vaccine development process worldwide. And we should be grateful for that, but that doesn't mean it wasn't careful. I'm trying to imagine a pharmaceutical agent in the history of mankind that's been so heavily scrutinized as these vaccines, not only in the scientific community, let alone in the lay community, where everybody's reading everything they can. So we have great confidence in that work, and that work's evolving. Our real-world experience is still relatively short. So what do we know? We know about minor side effects of a vaccine: headache, myalgia, maybe some fever, probably a day, maybe a few days. A lot of people feel nothing, maybe a sore arm. Those are the common side effects. Anaphylaxis, extremely rare, 1 in 100,000 to 1 in a million cases. And we monitor people after vaccine to look for that, and it's treatable. VITT, this is what we've been reading about: blood clots, vaccine-induced thrombocytopenia. Not unlike another entity we're very familiar with in medicine, HITT, relating to heparin. Again, it's treatable, it's rare, 1 in 100,000 to 1 in 200,000 cases. A few vaccines, specifically the viral vector vaccines, and for which age limits have been put in place to protect the public. 8 cases in Canada so far. Again, relatively rare when you compare the risk of COVID-19 infection, and I'll come back to that. In the long term, in the history of vaccines, side effects turn up within the first 6 weeks. You don't find out a year or 2 later after getting a vaccine that something bad is going to happen to you. So the studies lasted 2 months to account for this. So long-term side effects, apart from what I've just mentioned, are not a concern. Really unfortunate communications this week from the NACI Council in Canada, the Supervising Immunization Council, who talked about 4 vaccines potentially in Canada and there being preferential vaccines. What they should have said, in my opinion, is that we have these vaccines, here are the risks, and this is the risk of not getting the vaccine. The Alberta Chief Public Health Officer made a great quote where they tragically had 1 of 2 Canadian deaths from VITT. And she clarified that your risk of death from COVID-19 infection, if you're 50 to 59, is 350 times greater than if you receive the AstraZeneca vaccine. And your risk of hospitalization and being seriously ill is 1,500 times greater. Thanks.
Thanks, Chris. And the other quote I like is, the best vaccine that you can take is one that's offered to you. I mean, it really shouldn't be. We're so familiar with different names behind the vaccines, but normally that's not how this would be rolling out. So this third wave has really been driven by the variants of concern, and we saw how quickly the so-called UK variant swept through our region earlier this year, and its tragic impacts at the Roberta Place long-term care home. And that leads us to another myth, that the vaccine isn't effective against the variants of concern, and that it isn't long-lasting. So Chris, again, what's fact and what's fiction?
So again, this becomes part of our crash course in microbiology and immunology during the COVID-19 pandemic. Viruses, like other living organisms, are adaptable, and it should be no surprise to us that they may mutate and adjust in order to survive. We're somewhat familiar now in our general lingo about variants in our midst, and I'll use common terms: the UK variant, the South African variant, the Brazilian variant, maybe now the Indian variant, and a few others. When we look at these variants, there are different ways to assess how effective vaccines are against them. There's study data, which takes longer and is not perfect science, looking at patients who've been vaccinated and what's their success rate or what's their antibody level, something of that nature. Or there's real world data. How have countries performed where vaccination has occurred and where variants have been circulating? Study data is promising, especially for the UK variant, which is the predominant variant that we see in Canada. Not as much known yet about some of the other variants. At the end of the day, still, what we know today, very promising. But the real world data is much more convincing. If you look at a country like the UK or Israel, where vaccination has been very successful, variants have been circulating, their numbers in terms of cases and hospitalizations and deaths have been very, very successfully reduced. So we're winning the war with vaccines despite circulation of these variants. The dogma is that viruses are smart and they can mutate, and our immune systems are smart too. It's not that the vaccines won't work, it's to what extent they'll work versus the original virus that came out. As far as duration goes, again, in Canada we have just over 4 months real world experience. Other countries a little bit ahead of us. It would appear that the vaccines in circulation last at least 6 months in terms of immunity, and on that basis probably last longer, according to scientists, up to a year or longer. And you might know that in Britain, as of the fall, they're going to provide a 3rd dose, a booster dose for those 50 or above. The reason I mention this is that the work on this and the research is ongoing. This is an evolving concept. And those people are either going to receive one of the vaccines they received originally or a newly developed booster dose to deal with the variants and what that coverage could look like. So this is an evolving topic. Again, we're winning the war with the vaccines we have today, despite the variants in our midst, and this science is developing as we speak. So I think we have a lot of confidence in what's gone on so far. Again, the need to get people vaccinated as quickly as we can.
Thanks, Chris. That's excellent information. And Also my opportunity to thank you for your ongoing leadership. For over a year, we've all gone to our next panelist, Dr. Amir Coursavani, for the straight facts about this virus. Just as there are many myths about vaccines, there are a lot of misconceptions about the need to continue following safety measures. So Dr. Coursavani, another common myth we hear about vaccines is if someone had COVID, they don't need to be vaccinated. Amir, true or false?
Hi, Janice. Actually, it's not true. Even if you have a COVID infection, you need to get a vaccination for several reasons. First, we know that if you have a COVID infection, after 90 days, there is a chance of the reinfection. Although it's very rare and it's not common, but there are case reports after about 3 months, there are possibility of the reinfection. Second, as Dr. Tabut mentioned, the vaccines are safe. Even if you have a COVID in the vaccine, the side effects are the same. So it doesn't mean that if you have a COVID infection and get the vaccine, it increases the chance of the side effect after a COVID infection by the vaccination. All the studies show side effects are safe and the vaccine are safe. The third issue, again, is the variant. As we know, there is a possibility, and data shows that there is a possibility that you get new infection with the new variant or new variant of concerns. And I know that, as Dr. Tabut mentioned, that vaccines, current vaccines, they are working and they have some effect, get the infection after you having the COVID infection. And not get the vaccine after you have the COVID infection. And lastly, if you have a COVID infection, there are some studies shows that then you get the vaccine, it causes more prolonged immunity and boosts your immunity after the infection. And the reason for that, it acts like your first dose of the vaccine. And when you get your vaccination after the infection, it acts like your second dose of the vaccine. It boosts your immunity and causing more prolonged immunity after the infection. So for all of this reason, still it's recommended to get your vaccination after the infection. There is no reason not to get the vaccination after the infection.
Thanks, Amir. Myth to bust. Might just ask you to go on mute till I get to your next myth to bust. As often said, we can't vaccinate ourselves out of this third wave. We need people to strictly follow public health measures. So the next myth, Amir, is if someone is vaccinated, either dose 1 or 2, do they still need to wear a mask or follow public health measures, or can they just carry on with their pre-COVID routines?
Yeah, that's a very good question. It's still not clear. CDC just released some guideline for public health measures after first dose or second dose vaccination, because in the US, they have more vaccination and the cases are dropping. But in Canada, so far, we don't have any national guideline because we don't have enough vaccination people and we are still in the middle of the third wave. But overall, we know vaccination are working, and just yesterday, Public Health Ontario released some data. So from December to October, from December to April, about 3.5 million of the people vaccinated in Ontario. And after this 3.5 vaccinated people, there were only 0.06% or 2,200 of people get infection after vaccination. So less than 0.1% of after the vaccination, people get the infection. So vaccination are working, not 100%, but still working. So back to your question, again, it's not clear. We still need some more data to see what we can and we cannot do after the vaccination. But we are seeing some new guidelines coming. For example, yesterday, again, Ministry of Health released some guidelines regarding the long-term care cares and nursing homes. So one of the changes, if you are essential caregivers for your loved ones or your parents in the nursing homes, and both of you fully vaccinated, means you and your loved ones are vaccinated with 2 doses. Right now, you are allowed to hug your loved ones, hold their hands, or kiss them. This is a big change compared to the previous guidelines. So I'm hoping with this new data that's coming and the increasing vaccination rate and decreased case count, we'll see some new guideline coming near future. So it guide us what to do and what not to do. But as I mentioned, it's still not very clear. So for now, we have to continue. For now, we have to continue what we are doing. Keep masking indoor. Go outside and keep social distancing. No other thing.
Thanks, Amir. So until we know with certainty, we must still follow the public health measures. And we, of course, look forward to you sharing more of that research with us. You know, Amir, you and I have spent a lot more time together in the last year than I had the privilege of spending with you previously. I also really want to thank you for your leadership and your dedication. Thank you. And from a frontline ICU physician perspective, I would like to welcome Dr. Adarsh Taylor to his first town hall. Welcome, Adarsh. So what about the belief that if you're young and you're healthy, you can safely fight COVID, that you don't need to be diligent about safety measures, and you can take a pass on the vaccine? Certainly one of the hallmarks of this wave of the pandemic is that we're seeing very young people get very sick very fast. We were all shocked and heartbroken to learn about the death of a 13-year-old Brampton girl last week. That really hit home for many of us. Since the pandemic began, RVH has cared for 441 patients, and many of them ended up in our ICU. So Adarsh, there's a perception that treatment has really progressed since those early days, and the vast majority of people now survive COVID, so we don't need to worry too much about it. So between whether or not very young people can get sick and whether or not we need to worry, can you give us some perspective from the intensive care unit, Adarsh?
Thanks, Janice. Yeah, happy to. So, you know, our personal experience here in Ontario, as well as sort of data across Canada, basically tells us that, you know, the statement that if you're young and healthy, you don't need to worry about this is completely false. So just looking at just the numbers, thus far in Canada, almost 20% of all admissions to hospital are under the age of 50 years old, okay? A lot of these people don't have any other medical problems. And approximately 20% of our ICU patients are under the age of 50. That's what the sort of data across Canada shows, but our more sort of immediate sort of personal observations, me and my colleagues have seen very young, otherwise healthy people extremely sick in our ICU. We have sent 4 patients from RVH alone to Toronto for basically a lung bypass machine. So they were so sick that our ventilators could not support them any longer, and they literally needed to go on a machine to take over the function of their lungs. One of these cases has received a lot of sort of media attention. This gentleman ultimately required a double lung transplant. And this was somebody who was young and otherwise healthy. That's when you get COVID, and the question is if you survive. Speaking as a community respirologist, me and my colleagues are seeing more and more people refer to us. These are people from the first and second wave, by the way, who are, you know, in their 40s, early 50s, some in their 30s, who recovered from COVID but now are completely debilitated. You know, 35-year-old women who are now having trouble just doing everyday activities because of fatigue, headaches, shortness of breath. There's so many things about this virus we still don't know. And, you know, a lot of my colleagues are worried about when this is all over, we're going to be feeling the repercussions of this for years to come. So I would say that, you know, being young and healthy doesn't sort of grant you any sort of immunity, and you should do whatever it is in your power, both vaccination-wise as well as following public health measures, to do whatever you can to try to avoid contracting this illness.
Thanks, Adarsh. And just to maybe that comment about, has there really been progress on treatment, that the vast majority of people now survive COVID? So the myth is we don't need to worry too much about it. Can you just go over that again for us? Yeah,
so in terms of approved treatments for COVID, so over the last year, we've got 3 drugs that we can use. These are the only drugs that we have, okay? Dexamethasone, remdesivir, and tocilizumab. Difficult to say, harder to sort of pronounce. You'd be shocked at how little they shave off of the mortality from this illness. I mean, we'll take what we can get, but we're talking about a couple of percentage points improved survival. And those are the best drugs we have. Really, in terms of lung disease from COVID, all we have is time. We put a person on the ventilator, and we support them the best we can. We make sure nothing else happens to them while they're in the ICU, but we're essentially hoping they're going to get better. And that's not, that basically is our treatment right now. Time and hoping people get better.
So another myth busted, in that we do need to continue to worry. And even though there's a limited options on your table, it's mostly about doing the best you can do while they're in the intensive care unit under your care.
Absolutely.
Mm-hmm. So how are you doing, Adarsh? This is a long haul for intensivists. How are you doing?
Well, I think we're all a little bit surprised we're still here a year later. Personally, I thought everything was kind of blow over in a couple of months when this first started, and at the moment I've stopped making predictions because I'm consistently wrong about them. But no, overall, the intensive care community in Ontario is kind of hanging in. There's a lot of burnout. The nurses and respiratory therapists and other sort of staff that work in the ICU are doing an absolutely tremendous job. And, I don't think it comes as a surprise to anybody, but, when we see people gathering at rallies saying that this thing isn't real, we tend to take that quite personally. So I think dealing with things like that has been harder than actually dealing with the actual illness itself.
I guess it's unbelievable how people are gathering for these rallies, and for you so close, right in the thick of it in the intensive care unit, it would be very disappointing, quite frustrating, I am sure. So I just want to thank you for all that you're doing. Of course, extend that warm thank you to all of your colleagues and the whole team in the intensive care unit. And as it's continued to grow at RVH, the work we've done on behalf of the GTA has been amazing, and it takes each and every one of you to accept those patients and care for them. So again, from the bottom of our hearts, thank you very much.
Thank you.
We tend to focus on the clinical, physical impacts of this pandemic, but I think the silent pandemic has been the impact on mental health, especially for healthcare workers. So welcome back, Kathy Clark. This has been a tough, unprecedented year. And when it's over, right? We'll just let out a big collective sigh of relief, and then we'll all get back to normal. Kathy, is this true or false?
Well, thank you, Janice. This is definitely false. And I think what's really important, and I think Adarsh has just really called that to mind, is how many of our staff are struggling and how many of our staff are expressing symptoms of burnout. And we're hearing this broadly, not only at our own hospital, but honestly across hospitals in North America that we are connected to. And just yesterday, I heard a doctor from another hospital say, quite profoundly, we are all suffering with open wounds. And I think that's becoming evident. And so as we are preparing to crest this storm, as we would hope we are cresting, and by the fall maybe looking a little bit differently, we want to provide our staff with an extra measure of care and support. And so we are launching a peer support program. I hope everyone has seen the screensaver this week. I hope that you've seen it in the J&J update, and perhaps you've met Gina D'Antonio, who's been out doing some huddles with staff. But I hope that everyone is excited that we are launching this peer support program, because while it's not a panacea, it is, I think, going to be a huge benefit to all of us. So what is peer support? It is literally members of Team RVH helping other members of Team RVH. It's us helping each other. And RISE stands for Resiliency in Stressful Events. And that's the name of our peer response program, RISE. And that is a program that we are partnering with Johns Hopkins, one of the best hospitals in the world. Just yesterday, they officially added RVH to their big map. They added Ontario to their map just so they could include us. And that was an exciting day for us to see that we're really formally part of that Johns Hopkins community. But we already have about 20 or so people who have expressed a desire to be a responder. And it's important for you to know that these are members of Team RVH who are going to volunteer their time. They are not going to be paid for this. We are not looking for clinicians or therapists. We're looking for everyday members of our team who are compassionate and empathetic, who are active, non-judgmental listeners, and who are able to be calm in stressful situations, because we know that they're going to be asked to listen to some heavy stuff. So we're launching on June 16th. We will be open every day, but in 2 different time slots, between 7 a.m. and noon, and then again from 3 p.m. until 8 p.m., so that we can catch people at the end of shifts. One of the interesting things that we've been learning recently is a barrier to our staff reaching out for and using some of the other resources is that they fundamentally can't get enough private time to really seek those resources out and use them. So we're hoping that when people are at the end of their shift, they'll feel like they have a moment just to call us. This is strictly going to be on the telephone. Callers can be anonymous. We really want just to be listeners. And one quote that has really resonated with our team as we've been developing our program is this one. It says, "Sometimes what a person needs is not a brilliant mind that speaks, but a patient heart that listens." And I want to just give a quick shout out to our implementation team. They worked hard to really turn this great RISE program into something that will resonate with our RVH team specifically.
Thanks so much, Kathy, and thank you for your leadership on bringing the RISE program here. We've been talking about it at our Caring for You committee for some time, and it's just great to see 20 volunteers and those peers wanting to help as much as they can as we move through this. So no, it won't be a quick, everything's over, sigh of relief and getting back, and we know that we have to be thinking about our collective mental health as we move forward in the healthcare system itself. It's been a long and grueling year. Sustaining that pace and this level of worry and uncertainty is taking an immeasurable toll on all of us, and it will have a lasting impact. We talk about a post-pandemic recovery period because normal won't come with a flip of a switch. Now, the pandemic has impacted us all in different ways, whether we're like Dr. Taylor, and caring for COVID patients directly, whether we're helping our children get through online school, whether we're missing our family and friends or not being able to do the things we love. We're worrying about our safety and that of our loved ones as well, and we're all struggling during this third wave. So we do hope that the Caring for You committee can continue to operate and that the RISE program will be of some help as well. So the panelists today were excellent as always, really useful and accurate information, and you all did bust some myths today, so thank you very much for that. I'd like to close with a letter from a patient who's also a member of our Emergency Department and Mental Health Patient Family Advisory Council, or the PFAC. And I quote, "I was lucky enough to receive my vaccination at the Sperling Drive Clinic. I was wonderfully surprised to receive my shot from Dr. Catherine Armstrong. She made the process go smoothly and quickly and was such an overall positive experience. She's an outstanding, caring, and dedicated doctor who finds the joy and positivity in helping provide a solution during this crazy crisis. From the moment of my arrival with your awesome angels greeting everyone at the front door, processing us quickly through the registration procedure, administering the vaccine, and the follow-up to ensure there was no bad reaction, it was the smoothest operation I've ever encountered. Some of the comments I overheard confirm that everyone was impressed. You, your team, and all who participate, both on the front lines and behind the scenes, are to be commended for working through the nightmare you've been having to face over this past year. Congratulations on an extremely well-planned solution to a very challenging problem. You are so appreciated for the amazing energy you all have invested into saving our lives. Sue J." Words of encouragement like that help to keep us going. They illustrate the difference that each of you are making for so many people in our community, in our region, and beyond. So please never, ever underestimate that impact. Please also continue to stay the course, Team RVH. Stay safe and stay strong. Remember, we are all in this together, and there are brighter days ahead.